I'm one of the GPs working here at Victoria Point Surgery. I'm a Redlands local and I've worked in the area for many years. I've been here at Victoria Point Surgery for about just over 4 years now. In addition to my general practice activities, I have special interests in several clinical areas. One of those would be paediatrics. The other thing I'm interested in is family planning and weight management. Today I'd really like to focus a little bit, if we could, on one of the most important threats to our health in modern society, and that is weight management. The much mentioned obesity epidemic. Many people will have noticed recently the TV and print media campaign, Doctor on Your Side. That's the one where the GP gives her smiling patient standing on a set of scales a big high five and slides down the corridor on her knees. So while I give a good high five, I won't be doing any sliding in the corridor. Terrible osteoarthritis. I believe strongly that GPs are perfectly placed to address this huge public health risk. We're local, we know you and your family, and have knowledge of strong evidence-based science to support you in achieving your personal weight loss goals and thereby improving virtually everything in your life. We can help you with your health, your confidence, and generally your quality of life overall. The prevalence of overweight and obesity in Australia does continue to rise. We now have over 60% of adults currently overweight or obese. Sadly, Queensland actually leads the race to the death, so to speak, with a higher rate of overweight or obesity than any other state in Australia. This is not a state of origin that we want to win. The new National Health and Medical Research Council guidelines recognise that overweight and obesity are relapsing conditions that require long-term management and regular monitoring, just like any other chronic health concern. For this reason, GPs are really ideally placed to help you with your struggles. There is good news. For all patients with a weight problem, the loss of even just 5 to 10% of your initial body weight is achievable with support, and the health benefits can be honestly quite staggering. That includes things like reduced cancer risk. We can reduce your blood pressure, often by up to 10 millimetres of mercury for every 5 kilos. You have reduced risk of joint disease. We can improve your cholesterol profile. You will have improved respiratory function, improved rates of conception for couples who are trying for starting a family. Even more impressively, we know that the loss of just 5 to 10% of weight can reduce the incidence of type 2 diabetes by between 40 to 60%. And in newly diagnosed diabetic patients, we can achieve up to 50% reduction in their blood sugar levels with only this modest weight loss. Truly staggering, I believe, is the actual reduction in all-cause mortality of greater than 20%, which I believe is an extremely good return on investment for the sake of a 5 to 10% weight loss. So, I guess the take-home story is to make an appointment, to come in and discuss this with your doctor. Remember, we really are indeed on your side and really do want to help you achieve your health goals.